Hi, my name is Hunter Bailey, and today I'm going to be doing the IV checkoff. Here's my College of Nursing ID, and you can go ahead and scan the room. Okay, so the first step is going to be to verify the physician's order and verify hospital policy. Okay. So here's the physician's order, and there's an order to insert saline lock in AM for CT scan. I'm going to verify hospital policy. I'm going to go ahead and gather all of my equipment and have it with me and perform hand hygiene. Then I'm going to identify my patient using two patient identifiers. Jaguar Jones, medical record number 4176352, medical record number 4176352. He's also allergic to penicillin, and that's verified by the armband that says penicillin. Mr. Jones, today I'm going to be inserting an IV on you, okay? Do you have any questions? No? Okay, good. I'm going to provide privacy, position my trash can, perform hand hygiene, and don my goggles. Okay, so now I'm going to raise the bed up to a comfortable working height, lower the side rail, and put my patient either in supine position or sitting. After they're in the correct position, I'm going to go ahead and take my equipment and open it using sterile technique. So I'm going to go ahead and open my tegaderm, and I can just sit this down. I'm going to drop this. I'm going to move my 10 milliliter syringe over. This is my over-the-needle catheter. So I'm going to open it using sterile technique. And then I'm going to get my J-loop, and I'm going to open it as well using sterile technique. Okay, so now that I've opened it using sterile technique, I'm going to get my alcohol swabs. And drop this in the trash and grab my J-loop, and I'm going to swab the injection cap. Sorry, that's my dog in the background if you can hear. Okay, so I'm swabbing the injection cap. I'm going to dispose of this in the trash. I'm going to hold this in the air, grab my 10 milliliter syringe, and using sterile technique, I'm going to open the cap and drop, and then I am going to pull back slightly and then flush. Okay, and connect the two. Once they're connected, I'm going to flush ever so slightly. Then using a sterile technique, I'm going to loosen the hub just a little bit, so it'll be easy to grab, easy to loosen. I'm setting this back in the wrapper like that. Okay, so now what I'm going to do is I'm going to go ahead and put the waterproof pad right here. 3 principles for selecting a vein is I'm going to select a large, soft, spongy, and bouncy vein. I'm going to select it in the most distal portion of the arm that I possibly can, but I'm also not going to select a vein over any impaired skin integrity such as bruising or erythema. For fostering venous distension, what I can do is stroke the vein slightly, apply a warm compress, and also let the patient open and close their fist if they can, and they would do it slowly. So now I have my waterproof pad, and now that I've selected the vein that I want, I'm going to apply my tourniquet 4 to 6 inches above the site, and once I apply my tourniquet, I'm just going to move this over to the side, and I'm not touching the inside. After I apply my tourniquet 4 to 6 inches above, I'm also going to check the radial pulse. I'm making sure it's not too tight. Now I'm checking the radial pulse, and I have the waterproof pad down here as well. So now that I have checked the radial pulse, I am going to go ahead and move my saline lock And this is my break-in sterility. I got one break-in sterility. This was it. My cap fell out of the packaging. Normally I would not let that happen. So that was my one break-in sterility. But I'm moving everything to the side. Okay, just like that. So everything's ready. So now I'll perform hand hygiene and don my clean gloves. Okay, now that I've donned my clean gloves, what I would do is I would clean the site with a chlorhexidine prep, but one didn't come in my blue bag or my IV starter kit, so I'm just going to use alcohol, but normally I would use a chlorhexidine prep. So I'm going to get the site that I've selected and scrub with friction. I'm going to scrub horizontally, vertically, and in circular motions. And I'm going to state this, that I would do it for 30 seconds. I'm dispose of this in the trash. Let it air dry and then don't touch it. So my saline lock is already close nearby. So I have my Tegaderm nearby as well with all of my tape. So I'm going to get my over the needle catheter. And I'm going to remove the cap, dispose of this in the sharps, and I'm going to have it placed bevel up. I'm going to have it placed bevel up. And now, without touching the exact vein, I'm going to spread and hold traction. And I'm not going to let the hub of the catheter touch my thumb. And I'm going to insert at a 10 to 30 degree angle, bevel up. Mr. Jones, it's going to be a quick stick, okay? 10 to 30 degrees. Okay, and I see blood, so I'm going to advance another 1/4 of an inch after I lower my needle. And so now that I see blood, what I'm going to do is take my left hand and move the catheter up, but not the needle. So I'm advancing the catheter. And I am going to pop the tourniquet, and I'm going to hold pressure 2 inches above, right here. I'm going to hold the catheter. Okay, so now quickly I'm going to get my J-loop. I'm going to pop the top, and I'm not touching the top of this with my finger because I'm maintaining sterility. And I'm going to lock these in place. Just like this. And I'm still holding it in place. I'm getting my temporary tape and taping this. Okay, so now that it's in, what I can do is I'm going to get my saline flush, and I would pull back and aspirate for blood return, and then I would flush it out with the remaining saline. And so now I'm going to take off the syringe, dispose of it in the sharps, and I can just let this sit right here. So now I'm going to get my Tegaderm. I'm going to open it and dispose. And I'm going to tape right here over the catheter, but not the injection port. Just like that. Okay, once it's on, I can remove. But I'm going to save this piece of tape right here for labeling. So I would just put it right there. I'm going to dispose of this in the trash. So now what I can do, now that I have my Tegaderm over it, is I can take my temporary tape off, but I'm holding the catheter to stabilize it. It's ripping my paper, but that's okay. And ball it up. Just place this in the trash. Okay, so now I'm going to allow the IV to maintain a natural position. And I'm going to take my final tape and place it over. Okay. Whew. So now what I can do after the final tape is over is what I can do is I'm going to go ahead and clean up my mess. So I'm going to get my wrappers and I'm going to clean up any additional mess that I have, and I'm going to take off my clean gloves and I want to perform hand hygiene. And now I could get my piece of tape, like my label, and I would put it like on the edge of the dressing right here, and I would label this with the date, the time, the gauge of the catheter, and I would put my initials as well. And so I want to perform hand hygiene again, raise the side rail up, lower the bed, and inform my patient on how to not accidentally dislodge the IV and make it come out, and any complications of the IV infiltration. So this could be like infiltration, inflammation, and phlebitis. So I would inform my patient of all those signs and symptoms. So now I'm going to perform hand hygiene again before I leave as I'm leaving the patient's room. And I've already assessed them for comfort, and I'm going to document at the nurse's station. So I'm going to document the date, the time, the location that I put the IV in, the number of temps that it took me to put the IV in, the catheter gauge and length, my patient's tolerance, and I would also document if there were fluids present and the method of infusion and the rate, or in this case I would just document that it's a saline lock. Okay, so now the time has come that the physician has ordered for me to discontinue the IV. So I would come in and perform hand hygiene, and obviously the tourniquet would not be on, but I would perform hand hygiene, and I'm going to don my clean gloves. Okay. So now that I've donned my clean gloves, I would already explain the procedure to my patient and have the bed in the correct position that I need. So now what I'm going to do is I have with me right here some sterile gauzes. I'm just going to have it just like this, and I have some tape already prepared. So the first step that I'm going to do is I'm going to move the tegaderm in while I'm stabilizing the catheter, and I'm moving it in from all positions towards the catheter. It's not wanting to come off. There we go. And I'm stabilizing the catheter. And now I am going to stabilize it with my hand. I'm going to get a 2x2 gauze and hold pressure right here while I take off the other tape. Sorry, the tape is just really sticky on the pool noodle. Okay, so now I'm taking off the tape, and it's ripping my paper, but it's okay. Okay, so now that I have the tape taken off, I'm still going to hold pressure right here, and I'm going to keep the catheter parallel to the arm, and I'm going to slide it out slowly. Okay, and hold pressure. Now I'm going to look at the intactness of the catheter's tip and make note of it and dispose of it into the sharps container. Okay, so now that I'm holding pressure on it, what I want to do is I want to go ahead and look at the site where the IV was in and note if there was any complications, so redness, swelling, draining, tenderness, pain, or bleeding. So now I'm going to get another clean gauze, move this, and when I was holding it, I would apply pressure for up to 30 seconds if needed, but if the patient was on anticoagulants, it could be for a lot longer time. So now now that I have my new sterile gauze, I'm going to get my tape, and I'm going to tape it down and make sure that my patient is comfortable. So now what I would do after I have it in place is I would take my gloves off and I would perform hand hygiene, make sure my patient's comfortable, and I would document at the nurse's station. And this concludes my IV checkoff. Thank you.